Hi everyone, this is a recording of a roundup of 10 noteworthy risk related posts that came into my LinkedIn feed recently. This is the third of a series of recordings that you can find on the Let's Talk Risk website. And the idea here is very simple. It's to collect and share knowledge so we can learn from each other. In this recording, I've summarized each one of these 10 posts with a key point and a commentary of my own to explain why I think they are important. You will find the links to each one of these posts in the notes below, and I hope you will like them. So, here are the 10 noteworthy risk related LinkedIn posts. LinkedIn post number 1. Horst Simon advises risk practitioners to serve as advisors and facilitators instead of playing just a traffic cop. Key point. Traditionally, risk practitioners are seen as, quote, traffic cops, end of quote, mainly responsible for ensuring regulatory compliance. There is a need for a paradigm shift in this attitude. Why it matters? Risk management is not just about compliance, although it is essential to follow all applicable rules and regulations. As practitioners, we have an opportunity to help create real value for our organizations beyond just regulatory compliance. According to Horst Simon, quote, the traditional role of a risk practitioner as a mere traffic cop is long outdated and insufficient. Instead, there is a growing recognition that risk practitioners must be advisors and facilitators who actively contribute value beyond mere rule enforcement. End of quote. Our world is changing fast. Technology advancements in artificial intelligence and machine learning are driving rapid change in every industry. Risk practitioners now have a leadership opportunity to help their organizations navigate through these uncertain times. In doing so, they can play a pivotal role in shaping their organization's culture, where risk-based decision making can lead to a significant competitive advantage. It's all about facilitating empowerment at every level of the organization through communication and collaboration. But first, we must change our own mindset. Read the full post in the link below and continue the conversation. LinkedIn post number 2. Jijo James shares a new tool that significantly reduces device-related interruptions when used with the World Health Organization's surgical safety checklist. Key point. Surgical devices are becoming increasingly more complex. Physician and staff training is important, but we need additional tools and methods to ensure patient safety. Why it matters? Surgical device use accounts for almost 25% of errors during surgery. Many of these errors are associated with device-related interruptions or DRIs, such as absent or wrong device, improper assembly, disconnection, loss of sterility, or device failures. Patient safety and outcomes can be significantly improved by reducing these errors. Recently, an 86.7% reduction in DRIs was achieved by using a device briefing tool or DBT, along with the World Health Organization's surgical safety checklist. In addition, it also led to improvement in surgical team behavior and safety culture. It is not sufficient to only provide safety information to users in an IFU. Manufacturers need to do more to reduce DRIs associated with their devices. Tools such as DBT can help. Read the full post in the link below and continue the conversation. LinkedIn post number 3. Aaron Joseph recommends adopting a more flexible, quote, re-entrant design controls, end of quote, approach to manage frequent design changes and upgrades. Key point. Frequent changes in medical devices, especially in software, should now be expected as routine. Technology is moving fast. In this new environment, a one-size-fits-all approach to design controls is no longer practical. Why it matters. Medical devices are expected to function safely and effectively throughout their life cycle. Medical software is now an important component of many medical devices. In some cases, software itself is a medical device. As a result, frequent design changes should now be seen as routine. As Aaron writes in this post, quote, "This is especially important for capital equipment where most development projects will be upgrades to existing products and not new product development. It is difficult to evaluate which design controls and documentation need to be repeated for every change." End of quote. He recommends establishing predefined pathways to handle different scales of product design changes. This will also help in managing post-market changes in a more efficient manner. Read the full post in the links below and continue the conversation. LinkedIn post number 4. Stefan Hanzeiker offers 6 tips for boosting your risk management expertise while learning from failures is not an option. Key point. When it comes to risk management, the conventional wisdom of learning from failures and mistakes doesn't really apply. Most risks will never be realized, and thank God for that. Yet, they need to be analyzed and revised frequently. Why it matters. Risk management is not an exact science. As practitioners, we have to learn to deal with uncertainty. But there are no cookie-cutter formulas or textbook answers. How do we continue to learn and upgrade our skills? We can never be sure of our estimates. Some of the rare but highly impactful risks, such as a pandemic, a natural disaster, or a massive financial crash, have too much uncertainty and may never actually materialize within the time frame of interest. Stefan proposes these 6 steps to enhance your risk management practice. Number 1, reduce ambiguity over time. Number 2, cross-check assumptions and reality. Number 3, data, data, data. Collect and analyze data constantly. Number 4, tap into the power of artificial intelligence. Number 5, ask more why questions. And number 6, compare risks with observed deviations. Risk management is not a one and done activity. Practitioners have to remain vigilant and learn continuously to get better at this art. Read the full post in the link below and continue the conversation. LinkedIn post number 5. Wag Hannah shares how augmented intelligence tools can help support risk management while also enabling a culture of transparency. Key point. Technology is now enabling a more holistic approach to risk management instead of treating it simply as an exercise in risk avoidance or risk elimination. Why it matters. Risk is about managing uncertainty over time. Often we are dealing with what we don't know and have no way of predicting the future based on prior knowledge. It is only through actively collecting and analyzing data for patterns that we can improve our understanding of the continually evolving risk landscape. Fortunately, advancements in artificial intelligence and machine learning are now making our job easier. A new field of augmented intelligence is evolving to support us in analyzing risks to make risk based decisions by balancing them against expected benefits. We can now uncover non obvious patterns in the data, simulate what if scenarios, check our own biases, and consider more quantitative approaches in risk analysis. There is a lot of publicly available data on medical devices. Open data sources from the FDA offer us a chance to deploy these powerful tools to make better risk based decisions. Read the full post in links below and continue the conversation. LinkedIn post number 6. Vincent F. Cafiso seeks to clarify FDA's position on requirements for clinical studies in the QMSR. Key point. Clinical studies are an important part of design validation of medical devices. As we transition to the new Quality Management System Regulation, or QMSR, in the United States, it is important to be aware of the complete regulatory framework for clinical studies. Why it matters. FDA has not explicitly outlined all the applicable regulatory requirements for clinical studies in the final rule on QMSR. In response to a comment on this topic, FDA has clarified that the regulatory framework for good clinical practices, or GCP, has already been established in Title 21 of the Food, Drug and Cosmetics Act. Risk practitioners need to be aware of the GCP regulatory framework as they help their teams develop plans for design validation activities, which may involve clinical studies. In this post, Vincent provides a quick list of these applicable regulations. Number 1. 21 CFR Part 812, Investigational Device Exemptions. Number 2. 21 CFR Part 50, Protection of Human Subjects. Number 3. 21 CFR Part 54, Financial Disclosure by Clinical Investigators. Number 4. 21 CFR Part 56, Institutional Review Boards. Number 5. 21 CFR Part 46, Protection of Human Subjects. Medical device risk practitioners can be more effective in their role when they have a basic understanding of these regulations. With this knowledge, they can serve as a bridge between product development, quality assurance, and regulatory affairs functions. Read the full post in the link below and continue the conversation. LinkedIn post number 7. George Zach invites a conversation to identify risks in real-world activities such as clearing the snow from sidewalks and roads. Key point. There is an opportunity for risk practitioners to enhance their skills by observing and learning from hazards associated with daily activities. Why it matters. In a typical day, we encounter many hazards and make many risk-based decisions almost intuitively to safely complete our daily tasks. Often we rely on the predictability of daily life and controls built around us through a system of laws, regulations, and social norms. When we are confronted with an unusual situation, such as a massive snowstorm that dumps over a foot of snow in less than 24 hours, life can come to a halt. We are then confronted with new hazards that we have not seen in a while. George reminds us in this post that these unusual situations also offer us to look at them closely from a risk management point of view. We can look for hazards and consider potential sequence of events that may lead to a hazardous situation where we can get hurt. This will help us to take precautions while also offering us a chance to improve our risk management skills. Read the full post in the link below and continue the conversation. LinkedIn post number 8. Chuck Ventura offers tips for considering device design controls at the drug device interface in a combination product. Key point: developing a drug device combination product requires a careful consideration of factors that influence the interaction of these components and may impact the safety and effectiveness of the whole system. Why it matters: developing and manufacturing a drug by itself is a highly specialized and complex process. Medical device development and manufacturing also involves highly specialized and differentiated practices. In addition, there are different regulatory requirements for each, which has led to different practices in design and development, manufacturing, distribution, and post-market phases of the product life cycle. When it comes to drug device combination products, there are additional factors that must be carefully considered at the interface of the two during design and development. Often, practitioners working in this area find it challenging to adequately define the drug device interface because of their limited knowledge of the constituent parts. In this post, Chuck reminds us that it doesn't have to be that complicated. However, it does require us to pay close attention to factors such as extractables, leachable, sterility, and particulates on the device side, and factors such as viscosity, stability, dosage accuracy, and material compatibility on the drug side. It is important to bring in cross-functional and cross-industry expertise when developing these drug-device combination products. Read the full post in the link below and continue the conversation. LinkedIn post number 9. Daniel Adler spotlights a new FDA draft guidance on cybersecurity to cover any device if it includes software and internet connectivity. Key point: the regulatory framework for cybersecurity of medical devices is evolving rapidly. FDA has issued a new draft guidance to further clarify the scope of cyber devices, revised cybersecurity recommendations, and documentation requirements for pre-market submissions. Why it matters: whether your device is considered to be a quote cyber device unquote or not can have a big impact on the amount of evidence you will need to generate to prove that your device is safe and effective for regulatory purposes. The problem is that the regulatory framework is still evolving in the face of rapidly changing technology. That is why it is important to stay current with guidance documents that reflect the latest regulatory approach to medical devices with cybersecurity considerations. In this draft guidance, for example, FDA clarifies that any device that contains software and has the ability to connect to the internet is considered a cyber device. Even if it is not physically connected to the internet, but if it has the potential to connect through USB, Ethernet, serial ports, or near-field inductive communications, it needs to consider safeguarding against cyber threats. Read the full post in the link below and continue the conversation. LinkedIn post number 10. Marco Felsberger reminds us that we can't always reliably model extreme events and that managing risk exposure might be more effective. Key point: quote, all models are wrong, many are helpful, some are deadly. End of quote. There's more to understanding and managing risks than building sophisticated statistical models. Why it matters: our understanding of risk is often limited by the quote unknown unknowns, end of quote, as the former US Defense Secretary Donald Rumsfeld is famously said to have proclaimed once. In this post, Marco shares that we often struggle to see how risks are interconnected, and our attempts to quantify those risks only compound the problem due to the complexity of underlying and interacting distributions. We can't always push our way through these unknown unknowns by endlessly applying sophisticated statistical modeling techniques. When it comes to extreme and hopefully rare events such as natural disasters that caused the tragic Fukushima nuclear accident in 2011, we have to shift our focus from prediction to exposure. Marco reminds us in this post that, quote, it is time to acknowledge that while risk quantification is vital, it falls short in the face of extreme events, end of quote. Read the full post in the link below and continue the conversation. Well, dear colleagues, these are the 10 most interesting posts on risk management related topics that I came across in my LinkedIn feed. I hope you enjoyed them, but let me know your thoughts and feedback in comments below. If you come across a risk related post on LinkedIn or anywhere else that you find particularly insightful, please share that with me. And if it is your own post that you feel really excited about, I'm happy to consider that as well for a future recording. Thank you so much, and I look forward to connecting with you next time.